good evening and welcome to the Arab American Variety Talk Show. I'm Suad Asfour. We have very special guest tonight, Bissan Debis. Bissan was born in Beirut for a Palestinian family. As a Palestinian refugee growing up in the war, she attended numerous schools and came across unique people and experiences, which we will hear about today. She has a bachelor's degree in biochemistry from Beirut Arab University. After she graduated, she moved to California. She worked at Stanford University and joined a community of wonderful Arabs who are in the Bay Area. She left the Bay Area for a few years and moved to Dubai to support her children, Ahmed and Yara, who came with her to Dubai. She worked as a medical translator for doctors who did not speak English. It was during this time that she just met a hair transplant surgeon, Dr. Khan. She managed his clinic for hair transplant surgeries. Her career started here, where Dr. Khan started SMP, and Bissan became his medical manager. After its success, she moved back to the Bay Area in Walnut Creek, where she now is a partner at California Hair Pigmentation and now finishing her triology certification. Welcome to the show, Bissan, and thank you so much for coming.
Oh, thank you for hosting me.
So glad to have you with us.
Thank you so much. I appreciate it.
And also we have my co-host is Salwa Ghamrawi. Good evening, Salwa.
Good evening,
How are you
Saad.
doing today?
Great, thank you. How about you?
Beautiful, thank you. Very good.
Hi, everyone. I'm Salwa Ghamrawi, and I'm going to be the co-host for our program tonight. And I'd like to welcome our guest, Bissan.
Thank you.
Hi, Bissan.
Hi, how are you, Salwa?
I'm fine, thank you. It's very wonderful to have you tonight for our show.
Thank you.
And let's start it.
Of course. Thank you for having me.
You're very welcome.
You're very welcome.
Thank you.
First, I'm so curious about SMP. What does SMP stands for?
SMP is scalp micropigmentation. Actually, it is a solution for many men and women who suffers hair loss. It is a very invasive treatment. It have immediate effects. So what we do in SMP or scalp micropigmentation is we put tiny microscopic dots in between hair follicles that they look like hair, but it's not hair, it's just a pigment. So when you ask my daughter what mommy does, she say, mommy draws on people's heads.
That's cute.
So scalp micropigmentation, when we deposit these small microscopic dots in between hairs, so many of them will create like a carpet or a mat underneath your hair that it camouflages your thinning hair. So people who has thin hair, it gives an illusion of fullness. You don't see your scalp anymore. It decreases the contrast between your scalp and your hair. So we do that for men and women who are having hair loss. We do that for shaved head guys as well. We recreate a hairline, reconstruct a hairline. For many guys who want to look 20 years younger than what they are, it's a perfect solution for that. Also, SMP, we use it for camouflaging scars after surgeries, after we do hair transplant surgeries, or many plastic surgeries these days for women. The scars will be actually in between the hair on the scalp itself, so we camouflage it with scalp micropigmentation.
Wow, interesting. Never heard of that. This is my
It's a brand new technique. It's not brand new, but it has evolved through the years.
Okay.
It started I would say 15 years ago, but it was very primitive when it started.
Yes.
It really took off 2 years ago when a German company created this machine that the needles are actually simulate the hair follicles. When we draw it, actually, when I see it in my loops, under my loops, I can see that it looks like a hair follicles. And my patients always ask me how many dots you draw per day. I don't know, like 10,000 of them.
Wow.
So I'm sure it's going to get more popular.
It will. It is coming like a lot popular these days. And unfortunately, a lot of other people who are not like trichologists or they don't work under a hair surgeon supervision are doing that in hair salons or tattooists. I mean, this is a good thing, but I would like it to be under a hair loss management because it is semi-permanent, it lasts for 5 years. And for women who are going under a lot of hair loss for some reason or another, chemotherapy, radiation, I would like them to be under supervision, doctor supervision. I would like to stabilize the hair loss first and then do the SMP, because this is what the proper approach will be.
Wow, interesting. That's
Wow.
very good.
So you're saying people start to abuse this method
Yes.
and make it more commercial than
Right, right.
a medical thing.
Yeah, so I would like people to understand what SMP is and try to research what is the proper venue to go and do it.
So what made you go that field, that direction? Because this is pretty new.
Yes.
And
Yes.
it's a lot of risk doing something like that.
It
I mean,
is.
as a beginner.
It is risky, but of course I started doing that, I would say 4 years ago, when even the machines are totally different. I evolved my technique with the machine, I saw how the machine evolved, and I evolved my technique with it. And I attended many seminars. We recently, I went to London, and I attended a really very big seminar where people are sharing their experience about scalp micropigmentation. The reason why I went to this is that just by complete chance, when I met this doctor back in Dubai, and actually there's a nice story behind that. We were in a conference, and there was this young guy talking about scalp micropigmentation, and he is originally a tattooist, and he's trying to convince the hair surgeons that this is a right approach towards treating hair loss with camouflaging techniques rather than going invasive. So he was describing it, and it fascinated me. It's like, what? You're gonna draw on people's head? Let me know what's that. So he taught it to me, and we started it back in Dubai. We went to India, and we did a lot of Bollywood stars. We performed SMP on a lot of Bollywood stars, a lot of royalty families in Dubai, in the UAE. And then when it was time to come back to the United States, I came here, and here I am.
So were you the first one to introduce this in the United States?
We were with the first few people who introduced scalp micropigmentation.
So not the first one, among few people who started this method or this process.
Correct.
This method. But did your major when you study biochemistry and then later biotechnology, your master's, did it help you do good in this business, or just encourage you so you have enough tools or the background to start this
of course,
career?
Of course, it is. This is a medical field after all. And when I studied biochemistry or biology, I wanted to be a pharmacist, but it's all in the medical field. And that's why actually I'm doing the trichology certificate. This trichology certificate, trichology means the hair of the science of hair. So this certificate allows me to understand more hair loss treatments that are we can use over-the-counter medication, SMP. There's many camouflage techniques, many other non-prescription medication that we can help with for people who are having hair loss. Plus, it is a healthy lifestyle. Like when I studied biology, I loved biology. No problem. I loved biology since I was a kid. So back in high school, I used to write articles about nutrition. Nutrition is my passion. And healthy body, healthy hair, it's all connected. It's all gonna come back to one thing.
Well, you look like you have a healthy body and healthy hair.
Thank you.
Who else can benefit from this? Other than, you mentioned that a few Bollywood stars, who else on a regular basis can benefit from doing
basically every man or woman who have a hair loss problem, we can camouflage it immediately, even though they are under medical supervision to stop the hair loss, let's say. But you know, hair loss is emotionally devastating, and we want to help people who are going through this hair loss process to have kind of a camouflage, to make them less self-conscious, to make them feel comfortable about themselves. So even when we are comfortable with ourselves, we get treated properly. We treat ourselves properly. So
what ages it's recommended for? I mean, is it recommended for anybody under 18?
I wouldn't do that. I wouldn't do the risk of that. I mean, technically speaking, we can do it. It's a skin, and you're just drawing dots on the skin itself. But I wouldn't go that far.
Okay.
I would I would like my practice to be risk-free.
But now we need to know who are your patients, like men, women, young people,
All
old
ages.
people.
All ages. So basically,
But do we call them customers or patients?
they're patients.
They are
they're
patient because you're doing it in a medical field.
Yes.
But
Yes.
for like other people who are abusing this method,
I wouldn't go that.
they
I
call
would-
customers. They call them
They're-
customers.
Yeah, clients, customers. Yeah, yeah. But I wouldn't go that far because SMP should be regulated.
Is there any side effect running this procedure?
Not at all. It's a very superficial pigment. It's not even an ink. It's different kind pigments that is a gray based, that there's no color in it. Because we do that on purpose. We don't want it by time to change to blue or green, like any pigment or ink that use like a
the
tattoo.
tattoo usually changes color.
We don't want that. So we use a gray based pigment. So by time in 5 years or so, it start to fade and it just disappear by itself. So you come back again and you do it. And the good thing about that is you don't know how your hair will look like 5 years down the road. And you don't want to be stuck with one hairstyle for 5 years, for example.
So it has to be redone in 5 years.
Yes.
Pretty much it goes away.
Right, right.
But did I understand, like this is a permanent solution?
It is semi-permanent.
So
like, it will
how
go-
many years would last?
I would say 5 years, not more than that.
But does it differ from person to another? It depends on the like skin,
Right,
on
and the skin type, yes, skin type, right, right. Because more oily skin, it will fade faster.
How about dry skin?
Drier skin, actually, it will hold onto the ink more.
Oh, yeah.
Oh.
So I'll tell my patients, wash your hair before you come in with the most like dry shampoo ever. So they will look at me, really? It's like, yeah, because for now, for today, I
Yeah.
want your hair to be dry.
So is there any like step before, like preparation?
Just wash the hair
Procedure.
before you come in with a very dry, cheap shampoo.
How's the prices doing it? Obviously, people are usually they go for something new to try. Do you think it's probably cheaper than replacing the hair or implant hair?
Oh, yes.
So do you think this kind of business and this kind of treatment or procedure will take over and in replacement of the
Hair
implant?
surgery? Well,
hair?
that's a very good question. So hair surgery itself is an actual hair. So we take hair from the back and we put it where the thinning area is. Hair is a 3D structure. But at some point, there's like hair surgery which will stop at a point you don't have a lot of hair from the donor area. So this is where SMP comes in handy. You put the dots in between these transplanted hair to give it more density. So actually, it's a value for your surgery, and it gives just very good camouflage for your scar, for everything. So SMP and hair surgery comes along with each other.
So they
They
support
feed
each
it,
other.
yes. Yes.
Do they overlap?
They don't overlap. As my boss says all the time, the surgery is the cake and SMP is the frosting on the cake.
Oh, how wonderful this! It's a beautiful image.
It is.
That's
Yeah,
wonderful. to
But
know.
we talk about preparations and stuff like that. But do you recommend non-surgical treatments for hair loss?
Well, it depends on the case we have. So for example, I had a patient who has a severe case of alopecia where there's a virus that lives in his scalp that eats every single hair follicle. And when he came to our clinic, we were hesitant to do the scalp micropigmentation because in theory, this virus will eat also the ink we're gonna deposit. But since we were talking about it and the guy was, just do it, please, it is my last chance. And you know what? The SMP is a very superficial, so we're talking about the upper layer of the skin. So we said if we're just putting the ink over there, I think the SMP is going to be okay. So we discussed it with him, and he was willing to take this risk. It's financial risk. It's not any other. It's just a financial risk.
Yes.
It may stay. It may not stay. So after we finished it, 3 months later, he came back for a follow-up. It was amazing result. It was amazing result. And he was like, Bissan, you have no idea how you changed my life. He used to wear hat 24/7. He said, like, I even sleep in my hat. And now I have hair. it looks like hair because there's no hair, and we draw all these dots. So people, when they look at him, they see a shaved head guy.
Wow.
And he's like, it's amazing. And like,
so that's good for his self-confidence.
of course, of course.
That's wonderful.
Of
That's
course.
really good. I think we talked enough about it.
But just one more thing, Saad. So you're giving hope, new hope to a desperate people.
Yes.
And changing lives,
Right.
making them happier, or
I hope so.
building their self-esteem.
Yes, yes.
And
Losing hair is a very emotional, devastating
especially
thing.
for women.
Especially for women.
For women, it's a devastating
It is,
thing.
it is.
It's horrible
It
thing.
is.
The worst any woman
Oh, yeah.
can
Oh,
face.
yeah. Believe
so
me.
you're helping us.
Oh, I hope so.
That's very good.
Yes.
As a young woman, you are ambitious and talented. We need to know a little bit more about your dreams and what have you accomplished. I understand you published some books when you lived in Dubai. Can you tell us a little bit about your accomplishment in life?
Yes. Thank
Other
you.
than this work.
Other than this one. So when I used to work in the clinic back in Dubai, the surgeon I used to work with, he's like very fit and he eats very healthy, and like I always like jealous from him, like, tell me, what is your secret? And he's like, Bissan, you know what, I want to research my secret with you. I eat healthy food, but still I want more. I want to accomplish a clean, proper diet. I want to do a proper workout regime for my age, for my work hours, and like little sleep that he have, because he used to live here and he used to commute back and forth, like the commute from Dubai to the States. So what we did, we actually cooked in the office.
Wow.
We tried kind of breads, and we altered all. I used to make him salads, colorful salads, and then we said that why we put all this knowledge that we researched together in one book. And the one book, it says, it's called The Longevity of Life, that starts with happy heart, clean food, and lots of sunshine.
Definitely.
So
Wow.
we did that in one book,
A
and
beautiful recipe.
it's a very beautiful
Great.
recipe.
Very
Yeah,
amazing.
And, just
One book only? Just one book?
Yes, the first book it got published in Dubai actually, and then we tried to open a company for hair products, since we know a lot about hair, and we wanted to use avocado and flax seeds and all these combination of
You
stuff.
mean treatments for hair?
Like to put it in a shampoo, actually.
Shampoo.
To put it in a shampoo, and we worked hard for that, but actually still we're working hard on that.
You're still working at it?
Yes, still it's a
Good,
lot
let
of
me know
work.
when you're done. I need
It's a
some.
lot of work. It's a lot of
Curious to
work.
know what happened.
It's a lot of work,
Inform us,
believe me.
please. Bissan, you had a very challenging journey since you were born till now, and you kept fighting back, and you stood up and you fought for your rights, and here you go. You're now young, beautiful, talented lady, successful,
Thank you.
and happy one.
Thank
So tell us what your secret, what keeps you keep going and hold the positive energy.
The smile. The smile. Keep smiling.
Keep smiling.
That's
Beside being Palestinian and fighter, keep smiling.
Yes. So basically, to
That's
begin,
easy to do. No, it's not.
exactly. No, to begin with, we are born actually to be optimistic in this life. It's just the way I was raised in the war, and the way my father and mother was fighting with joy. They just fight, and they never give up on anything. We are born to fight, and to us it's not considered fighting. This is how we are. We just do stuff.
It's a lifestyle.
It's a lifestyle. We do stuff.
Yeah,
and
some people, they look at it as fighting
No,
it or
it's not.
working hard at it. It should be easy.
it's not.
It should not
Is
be
it natural
a fight.
coming
It
naturally
just
from
comes-
inside?
Yeah, it comes just from inside. And when I see everything in place, I will just like, no, I have to fight for something. I don't like easy stuff.
So you pretty much program your mind to accept and prepare yourself to find what you're looking for.
Yes, it's just, I don't consider it as fighting. It's when I have a challenge, the adrenaline will go up in my system, and yes, that's what we're gonna do today. When I have a challenging case, other people say, you know what, let's not do that. Like, let's try it. What's going to happen? What's the risk? What is the worst
So
case
you do
scenario?
your best when you are challenged.
Yes, I do.
Bravo,
I
bravo.
love it. I love the challenge. I don't like easy stuff.
Yeah.
Easy come, easy go.
Good, good. That's really interesting. And I think Middle Eastern women, they have
Yes.
tendency to be tough in a situation where they have to be tough.
We are born
in a
like
tough
that.
situations. So what message you want to give to any woman, not just the Middle Eastern women, who are starting their own business?
It just be kind to your patients. I am friends with all my patients, and when that practice it goes on a personal level, patients will feel very comfortable and they trust you, and also you feel as a practitioner, you feel comfortable and you want to give the best to that patient depending on his needs and his lifestyle and what he wants. And since I'm doing a 5-year impact on his life, I want to know actually where he's going for the next 5 years to give him what he wants.
So you stay connected with your
Stay
with
connected.
your
Usually you
clients.
do follow up with
I
your
do, I
patient
do, I
to
do.
see how
Yeah,
they're
yeah,
doing, or
yeah.
are they happy or satisfied with your work.
Yes, yes.
Then we need to ask you, what do you promise yourself or your kids?
I want to see Ahmed and Yara the happiest kids on this earth. I know
Of
it's
course,
a dream
all
of every
moms,
mom, but
all moms love to do
yeah,
this.
it's just when I look at their eyes, it's just brighten my heart from the inside. And I want them to do, like, the sky is the limit. Anything they want to do in life, I will make sure to make it happen for them. I will do my best.
What a wonderful mom you are.
Oh, thank
So
you.
this is another side we don't know about you.
Oh, thank you.
But one more thing I need to know from you. Like you said in your biography, and really, really it got me, and I love it. You said, if a door shuts in front of you, you believe
doors.
another door, and you are sure, and you believe in this, another
Oh,
door
yeah.
would be open.
Oh, yeah.
So this is your
It's amazing, actually, when it started.
belief in life.
Yeah.
This is what you.
It's amazing when back in college, when like because of the political situation in Beirut, door closes in front of me, I thought I was like grumpy and sad, and then 5 years later, like if you go back to that, what happened? Oh, actually, it was a good thing. Then another door closes in front of me, then another one. By now, when a door closes, I'll say, "Yay, excellent! That's a good thing. It's going to happen
Something
after
new
that."
is coming
Something
in.
new is
Something
coming, and it's going to be
big.
way better than
And
before.
it's going to be way better. Yes, I believe in that 100%. So if a door closed, that's a God's way of telling you that's not going to work for you. This is better way for you.
So it's a sign for you to change your way or your
To
path,
change, yes.
or to think out of the box.
Yes.
What is
100%,
a
100%.
difficult experience any woman your age, your performances can face? Any difficulties during their career?
Yes. Somebody who will limit your dreams, somebody who will tell you, I'm the boss. You just do whatever I tell you to do. Because we have dreams and we are so ambitious, and I would say a good company or a good partner will help you grow, because when you grow, everybody around you grow.
So you need a little positive push.
Yes, yes,
That
from
will help
around
a
you,
lot.
and the support that you need. And we fail, we have mistakes. We should not hold ourselves like victim to this mistake. It's okay. Learn from it and just keep looking at that mistake. It will push you like really hard.
Are you happy you live in the United States?
Oh yeah.
Do you feel like you are lucky here because there's more opportunity, and you probably would not be doing this if you're still back home?
Well, of course, United States gave me the opportunity. I would say, in 10 years, I will have it back in Beirut. We are just super fast.
So you're lucky to live in this
Of course,
country.
and I'm lucky to
It's
have.
the land of opportunity.
Of course.
And you're taking it. You're not wasting any
No.
time, and you're planning for your future.
Mhm.
So what's your plan in the
I
short run, long run?
10 years from
10
now,
years,
where
5
you think
years.
you will be?
I'll be on the beach.
And the beach?
Oh.
Yes, doing my SMP. So
Doing what on the beach?
I'll tell you. Of course, I will have my walks and my coffee in the morning, but
Okay.
during the day, I created this clinic in my head where it has the walls are water to prevent anything from coming outside to inside, and I'll be treating the patient sitting on my chair. He will be looking at the beach.
Oh, interesting.
And I want to see my kids
What
jumping.
a beautiful image, picture.
Yeah.
So you draw a picture in your mind, and are you trying to make it real?
I want to make it real.
One day,
Yes, very soon.
very soon.
Yeah, you sound like you take your experience seriously and you improve on it. You improve
I
up on it.
hope so. I
Yes.
will work on it as hard as I can, and I would ask God to just give me guidance and lots of more energy.
So as a person, what do you wish for yourself, for your kids, for your life in the future, new life, create a new family, start a new family?
Yes.
Just if you like, it's optional. You don't have to
Of
answer
course.
this.
No. One day maybe I'll be living in Italy.
Okay.
Now I met my fiance 2
Yeah, I
years
want to
ago.
say, why
Congratulations,
Italy?
by the way.
You're welcome.
We heard the wedding is coming soon.
It is coming soon.
Are we invited?
Yeah. Of
To
course,
Italy,
you're
yeah.
gonna do
If
that.
if
To
she send
Italy
me
or
the
to
ticket.
here?
You are gonna organize the wedding. You're not
Oh.
invited. You're gonna organize it.
Oh, that's a privilege, really, really. We're honored to do so. We'll be
thank you.
happy. Me and Suad will step in.
Thank you.
Well, unfortunately, we're running out of time.
Time is
We love to
running.
hear you more and more,
No
but
problem.
we wish you the best of luck
Thank you so much.
in your career and
you.
your raising your kids.
Thank you.
Wish you the best.
We wish you lots of luck, the best luck, and we're very happy to have you here.
Thank you so much.
Good luck,
I
Bissan.
appreciate.
Good luck on your
I
career
appreciate
and
it.
your marriage.
Thank you so much.
Hopefully to see you at the wedding.
Yes.
What a beautiful bride she'll be.
Thank you
Yeah.
so much.
Okay, thank you. We're out of time. We have to go. Good night. Thank you for watching us.
Good night. Bye, everyone.